Did you know that you could have a sexually transmitted disease, or STD, and not even know it? Gonorrhea affects thousands of people each year. As a nursing student and as a nursing assistant, I have spent time analyzing and learning about diseases such as gonorrhea. In order to fully understand gonorrhea, the causative agent, characteristics, and treatment options should and need to be analyzed. To begin, gonorrhea is caused by a bacteria called Neisseria gonorrhoeae. This bacterium is considered to be gram-negative, which means that they have a thin peptidoglycan cell wall as compared to a gram-positive bacteria. They are considered to be harder to kill because of the lipid component in their cell wall as well. As seen in this photo, the bacteria are represented with a pink tint, which indicates that they are indeed gram-negative. Here we are also able to see that this bacteria is a diplococci. A top-ranked health organization by the name of Mayo Clinic categorizes 6 distinct characteristics of gonorrhea if the symptoms are present. If a person is experiencing a symptom in their genital area, they may be experiencing discharge from the penis if they are male, or discharge from the vagina as a female. Now, this discharge is abnormal and is not considered to be what the regular woman would experience. A person may also experience painful urination, and this applies to both genders. A male may experience testicular pain, while a female may experience abdominal pelvic pain. A woman may also experience bleeding in between their periods. If gonorrhea affects the eyes, a person may exhibit pain, sensitivity, or even discharge from this region as well. If gonorrhea affects the throat, a person may experience symptoms of the regular sore throat, and they will also have swollen lymph nodes or could see white or yellow-hued patches. If gonorrhea spreads into the joints, a person may be met with the typical signs of inflammation, which include redness, heat, and swelling in the area. If gonorrhea has infected the rectum, a person may be met with itching, discharge from this area, and pain. A person infected with gonorrhea may also have discomfort or pain during intercourse. On the right side of the screen, I have included various images of what gonorrhea could look like at different infection sites in the body. At the top, we are able to see that a person's throat has been infected. Here we are met with the classical symptom of the white patches that have overtaken the area. Underneath of this image, we are able to see abnormal discharges between both the male and the female. On the left, we are seeing discharge from the penis, while on the right, we are seeing an abnormal discharge from the cervix of a female. Underneath of this image, we are able to see that gonorrhea has infected this individual's eye. Here, they are met with a significant amount of redness. A respectable medical center by the name of Cleveland Clinic has noted areas of importance for why treatment options are so significant in a gonorrhea case. Gonorrhea can cause infertility, scarring, affect other organs, and risks for newborns. With the infertility, this is associated with when the infection has spread past just the cervix into the uterus and into the fallopian tubes and ovaries. In a male, they may see scarring in the urethra, as this is where the infection takes place. Gonorrhea has the ability to affect other organs, absolutely, and the risk for the newborn is whenever a pregnant mother is giving birth to a newborn who is infected with the disease. Whenever the newborn comes through the birth canal, it is possible that they pick up the infection from the mother as they are going through that vaginal canal. The CDC, or Centers for Health Control and Prevention, is a reputable public health institution. They have noted various ways that a person could prevent themselves from getting this disease. The first way includes to have protected sex. Different ways to ensure this is through utilizing condoms or dental dams during sexual activities. Another way includes abstinence, which refers to abstaining or not partaking in any sexual activities. Other ways to prevent this include items such as ensuring that the sexual partner has been recently tested for various STDs, and also limiting the amount of sexual partners that a person may have. If a person is infected with the disease, the Center for Disease Control and Prevention, or CDC, has also made notes about which antibiotics work best. The top recommended antibiotic is ceftriaxone, which is given as an injection. If this antibiotic is not possible for the individual, then gentamicin, azithromycin, and cefixime are recommended as well. The way that the leading antibiotic works is described by Drug Bank, which is a very reliable source for obtaining information through different medications. This group has identified that ceftriaxone works by disrupting cell wall synthesis and through impeding on the enzymes that function to build the cell wall. Therefore, if the bacteria is not able to build a structural cell wall, then this will lead to cell death. In conclusion, gonorrhea is a bacteria called by Neisseria gonorrhoeae. It may not present any symptoms, which is called being asymptomatic, although it can affect the eyes, genitalia, throat, joints, and even the rectum. The most popular treatment option is ceftriaxone, which disrupts the cell wall synthesis. Throughout the presentation, I have made quite a few references, and so they are presented here with APA format as well. Thank you very much.